The KwaZulu-Natal Health Department has warned of an outbreak of pink eye, particularly in eThekwini. Provincial health officials say the cumulative numbers of cases jumped from 161 to 1,044 between January 29 and March the 3rd, with most cases reported in the eThekwini district. They have urged the public to avoid pink eye by practicing good personal hygiene, including regular hand washing and avoiding the sharing of face cloths, eye cosmetics and pillows. Dr. Ndivhuwo Khwashaba, a specialist physician, now joins us for more on this conversation. Ndivhuwo, thank you so much for your time this evening here on SABC News. Perhaps let's start off here. How dangerous is pink eye?
So, regarding how dangerous this is, the issue mostly is that it's contagious, especially the viral causes, because this is predominantly a viral conjunctivitis, so which then means if someone touches their eye or whatever their eye is in contact with, finds or lands in someone else's eye, then it quickly spreads in that way. But it's just a very uncomfortable type of health issue that you do not want. But in terms of dangers related to death, not so much.
And how does one identify the symptoms for pink eye?
So symptoms for pink eye is usually redness of one or both eyes. It could be itchiness of one or both eyes, and you can have a gritty feeling where it feels like there's sand in your eye. It could be on one eye or both eyes, and the eyes tend to become very teary, and you tend to get photophobia, or as we say, sensitivity to light. And in the case where there is a secondary bacterial infection, then there's a yellowish discharge as well, which forms a crust in the morning. Then the eye would not be able to open properly because of the crusting.
And do we know exactly what has caused the latest outbreak in eThekwini?
According to my information currently, it's not so clear, but I can tell you that the most common virus that is associated with pink eye or viral conjunctivitis, as it were, is an adenovirus, which is usually self-limiting, and so it would basically last from about 7 to 14 days. But if it were other, viruses like herpes simplex virus or a varicella zoster, it tends to last a bit longer, like 3 to 4 weeks, and that might actually need hospital treatment.
How can it be treated?
So treatment is symptomatic, as I've already said, that it's self-limiting. So one really needs to basically, continue with basically the good hygiene, and if anything, when the, how can I put it, when the gritty feeling is there in the eye and stuff, one needs also to use things like artificial teardrops, and just simple painkillers should really do the trick. And for those who wear contact lenses and you develop a pink eye, then you should avoid using that. And yeah, so that's basically it. And in other cases, we go on to give topical antihistamines and decongestant eye drops, just to relieve the inflammation, as it were.
And if maybe somebody recognizes that maybe I may have a pink eye, what should I immediately do?
So first and foremost is preventing, contamination of others. And sometimes it will just be one eye. So you want to prevent contaminating your other eye, So this prevention basically includes always making sure that you don't touch your eyes with your hands. And wash your hands regularly, and always use a clean towel or a washcloth daily, and don't share towels and washcloth. And if you could change pillows often, pillowcases often, and always throw away, when you have a pink eye, you must always throw away your eye cosmetics like mascara. And of course, I don't have to mention that you should be sharing your eye cosmetics. And usually that assists, but it's always better to go to a doctor to basically get checked, because it's not always a typical pink eye or an adenovirus type of viral conjunctivitis. It could be something more grave, like the viruses I've already mentioned. But occasionally, it could be a bacterial infection, and you would not be able to know how to identify. And in that case, an antibiotic is going to be required. Sometimes it's an allergic type of conjunctivitis, because it's going to give you a pink eye as well. But with that one, it's usually associated with other allergic symptoms like allergic rhinitis or runny nose. Some would have sinusitis, some would have like a postnasal drip, but this is usually in the presence of an allergen. But going to your nearest clinic or your doctor, they will be able to identify which is which and treat it appropriately.
And Dr. Ndivhuwo, are we only seeing this outbreak in the eThekwini region, or have we spotted some of these cases elsewhere?
At this point, I have not gotten any information regarding spreading elsewhere, but looking at how interconnected we are, I would not be surprised that we already have spread in other areas as well. Maybe there's underreporting that is happening, or maybe other people are just not aware. Other healthcare practitioners are not aware of an outbreak of pink eye. So in which case they would still treat it in their respective corners and not necessarily notify it.
Dr. Ndivhuwo, thank you so much for your time this evening and for that clarity. That is Dr. Ndivhuwo Khwashaba. He is a specialist physician, and he was just giving us insight there when it comes to how to treat the outbreak, the latest outbreak for now being in KwaZulu-Natal in the eThekwini region, and of course that being pink eye.